Ranjan has a busy schedule. He works hard at his job. There are deadlines, budgets, clients, office politics. But he has everything under control. He maintains a busy social calendar as well. Always the life of the party, his friends and family say he never stays still and loves to make everyone laugh. That's why what happened on August 18th came as a shock to his friends and family.
Now we are talking of India being the world capital of heart disease and diabetes. So if we look at the urban population above the age of 50, 1 in 10 will have a problem with heart. 1 in 10 is a huge numbers that we are talking about. Heart disease of different natures. Today what I am going to focus on is coronary artery disease, where there are blockages in the arteries which need to be cleaned up, cleared up, stented or surgery or operated by surgery. Now this disease comes from various factors. The most common cause is a genetic, that if father has, brother has, there is a high likelihood that the other siblings may also have. The other reasons are diabetes, hypertension, cigarette smoking, lack of physical activity, eating junk food.
The heart is like an engine requiring fuel, and that fuel is blood. If the amount of fuel delivered is less than what's required, there is pain. Coronary artery disease is a condition in which blood supply to the heart is partially or totally blocked.
The patient generally complains of chest pain or breathlessness or exertion. Now the chest pain can be of different natures. What we focus on is chest pain that comes on exertion and is relieved on rest. Once the patient has symptoms, then we go on to further tests to know whether he has heart disease or not. Echocardiography and stress test are the commonest tests which are done at many hospitals and many clinics. Once we have a doubt on the basis of these tests, then we generally go further investigating using a CT angiography or a coronary angiography to find out what exactly is the position in the blockages.
An important step in preventing permanent damage to the heart is recognizing signs of a heart attack and getting help immediately. The warning signs to look for are chest pain, shortness of breath, faster heartbeat, weakness, dizziness, sweating.
Heart attack symptoms can be variable, but it is very important to understand for every individual that what heart attack actually happens and how does it feel like, because only then an early treatment can be done. So generally what a heart attack patient feels is that he gets heaviness in the center of the chest, which is generally on the center, not localized to left or right side. It then radiates to both the arms. It may or may not, but it can radiate to both the arms. It is not necessary that it should go to the left arm. and it could go to both, or it could go to only to right. But sometimes it goes to the neck and sometimes it goes to the jaw. So some patients come and tell us that it's feeling as if the neck has been strangulated, and it could be a symptom of heart attack. So if a patient who's particularly diabetic, cigarette smoker, hypertensive gets these symptoms, it should be immediately investigated. People who are the age of more than 70 years or who are diabetics may not get these classical symptoms. What they may get is feeling uneasy in the chest, feeling as if there is something going wrong, or feeling breathless. So breathlessness is the commonest symptom by which elderly presents with a heart attack.
If you or someone near you suffers a heart attack, it is very important to get them to the nearest hospital as soon as possible.
So important for the patient to reach in time. This is the golden hour of heart attack. If a patient comes to me within 1 hour of a heart attack, or maybe up to 2 hours of a heart attack, we can treat him so well. I can treat him so well that he will never be known to have had a heart attack. So he can be saved of problems in life. However, if a patient comes after 6 hours, he keeps losing his muscle. Golden hours is up to 6 hours. So if we can treat up to 6 hours, we produce a lot of benefit.
If you are diagnosed with coronary artery disease or worse, have suffered a heart attack, do not despair. It is not a death sentence. Modern medicine has many options for treatment available that can make life go on as close to normal as possible.
Once the blockages develop in the vessels which supply blood to the heart muscle is not getting enough blood now. Now these blockages, they could cause a heart attack. Now angioplasty attempts to open these blockages, and by putting in a stent, we ensure that these blockages do not come back again, and the patient lives again a healthy life which is free of angina and free of a risk of a heart attack. So the angioplasty procedure is pretty simple. Catheter is a very thin tube which is inserted either from the arm or from the groin, and this thin tube goes all the way along the vessels into the heart, and through this tube we inject contrast and visualize on the X-ray equipment whether there are blockages or not. We pass a small thin wire all across the coronary artery, bypassing the blockage. On this guide wire, then we pass a balloon. The balloon is inflated where the block was. This will make a passage for the stent to go in. Then we remove the balloon and then pass a stent which is again balloon mounted. This goes gradually on the wire and then placed where the blockage was. And then the balloon is inflated and the stent stays in place in the coronary artery. Once the stent opens and is placed in the coronary artery, it looks like this. It's a cylinder which is opened up. So this is what the stent actually looks like.
After angioplasty, the patient spends 1 or 2 days in the hospital. This is a good time to ask the doctors and nurses who are taking care of you about the future course of action.
There are a few things which are very important. In the first 1 or 2 days, we look at the site from where the catheter was inserted, which could be from the arm or could be from the groin, because sometimes clots form there, sometimes blood leaks there. So we are very careful with these sites, but we are careful to tell the patient that look for any bleeding in these sites, which generally does not happen, but this is a precaution which is taken. But most of the times I allow my patients to go back to work next day after the hospitalization, because they are now normal, their stents are working very well, so they can immediately go back to work unless they've had a heart attack when some rest is involved. And they come back to exercise schedule within a week's time after the angioplasty. The medications are extremely important. So there are 3 agents which cannot be stopped at any cost. One is aspirin, which the dosage the doctor can decide. Then there is another antiplatelet agent which could be clopidogrel, which could be prasugrel, which could be ticagrelor, depending on what the doctor has written. It could be any one of the 3. It is not necessary that all 3 or which one is to be given. So one addition to aspirin and one statin, which could be a different statin, but statin is a cholesterol lowering medicine and is a wonder drug, is essential for all patients who undergo an angioplasty. Other medications will be added on for those who are diabetes, those who have hypertension. So for treating blood pressure or hypertension, you will need some additional medicines. So once a patient undergoes a stent, does not mean that he will not get a blockage again. So he has to be careful. He has to be on the preventive side. He has to take very good care of himself. This is a question which is commonly asked, that can I eat out? Now, yes, he can eat out. He has to select the quality of food. He cannot eat junk food. He cannot eat which are fried stuff there. So, I generally ask my patients to refrain from indulging into heavy foods habits. The second question with eating is whether they can drink or not. Now, this is a very difficult question to answer because patients come and tell me that they have read on the net that alcohol helps prevent heart disease. Now, this is something which is not correct. The Western literature does show that drinking wine or drinking moderate amounts of alcohol does help heart disease, but the Indian studies have not contributed to that. The Indian studies, on the other hand, have shown us that alcohol is not good for the heart. I will tell you why. Now, what happens in Indian alcohol drinks are that Indians are alcohol binge. They go on a binge. They drink a lot. And with drinking, the food habits just go for the toss. They eat a lot. They have heavy snacks with the drinks. And then they just can't control what they're eating. So, best is to refrain from alcohol. At the most, to make it to the minimal as possible. This is regarding the diet and alcohol. Then the other lifestyle change that should happen is that anybody who is smoking should actually quit smoking. Smoking is the worst enemy for heart. The third thing that should be a change in exercise schedule. Everybody should exercise. It's very, very important to exercise. Simple things can really help. Going to the market, don't take your scooter, don't take your car, go walking. If you're in the office, don't take the lift, use the stairs. Simple walks are very important. So if somebody can walk 45 minutes to 1 hour a day, I think that's more than enough. Yogic exercises are very, very good. It is not that every patient we have to prescribe that you do a yoga, but if you can do yoga, it's helpful. Now, what should be the intensity of exercise will depend actually on the age. If in a younger individual, I would prefer that they go on jogging, they go on treadmill and try to exercise as much as possible. Play sports because it's interesting. So if you play squash, tennis, badminton, whatever, you will be able to do it. It's easy, it's not difficult, you are involved in that. You will enjoy that, it's not boring. Now, if a diabetic has had a stent, then it makes him even further high risk to get another stent. So, a diabetic has to be very carefully tackled. Now, first thing is he should lose weight. Second thing is he should be on medication which control diabetes. We have now very good medicines which can control. They should have glucometers at home. They should do self glucose monitoring testing, where they will be told the targets that the fasting glucose should be less than 120, the postprandial glucose should be less than 180. So they should keep these targets. So every 3 months they should undergo a test which is called HbA1c. It will tell us what has been the control over the 3 months, and it should hover less than 7 or around 7. It should not be very high. So these are the important things that they have to take care of. Then physical exercise is extremely important, as is with the other group of patients, that they must exercise. Then control of diet in a diabetes is much more important than any other individual, because most of the patients will see that just by controlling diet, their medicines come down dramatically.
Last but not the least, make sure you're diligent about the follow-up routine with the doctor. Let your doctor know of any discomfort, new developments, etc. As the old adage goes, prevention is better than cure. Living a healthy lifestyle is the key to avoiding coronary artery disease. It's never too late to listen to your heart.